Okay, hello guys. So welcome to our online class. So we are now, congratulations, we are now in module 2, which is health system. Yan. So today we're going to learn about health system. So ma'am, you may ask, what is the relation of health information system to health system? So basically guys, health information system is a building block or a unit or a part of the health system. Yeah. So guys, we will learn the bigger picture, which is the health system, where your health information system operates. Yeah. So that's our discussion for today. So guys, if there are things that I haven't mentioned, you can read it on your module. Yeah. So let's start. So for the objectives, we want to define our health system in the different perspectives. So international, so based on the perspective of WHO. Yeah. Identify the goals and functions of a health system. So when we say a goal, what is its purpose? And what is its mission? And when we say function, what is its intended activity? So something like that. Next is we want to explain the relationship between the system building blocks and health outcome. So we have the different building blocks, and the example is health information system and how will it impact the health outcomes. And we want to explore, guys, the Philippine health systems and universal healthcare. So class, we will learn, marami tayong matutunan today, so join me, okay? So class, let's explore this different news that we are hearing over the last few months. So tingnan lang natin. So COVID-19, an eye-opener on weakness of Philippine healthcare system, according to Duque. Government short of 3,000 health workers amid COVID-19 pandemic. DOH says COVID-19 pandemic a trigger for health reforms. Substandard COVID-19 test kits have entered the Philippines. What else? So now, so there are news that the PPEs were overpriced. As of August 9, we have 3,504 deaths, limited testing laboratories, few isolation and quarantine facilities. We have now crossed the 200,000 mark of COVID-19 cases. So guys, so based on this news class, almost all of this news, it is under the umbrella of health system. So basically, they are very much responsible in promoting health and preventing deaths that is caused by a pandemic, which is COVID-19. And so class, there's so much problem when it comes to health systems. So we will learn what are the root causes of these problems, where are these coming from. So in light of this, so let's learn about the health system. Yan. So class, ang raming problema sa health system, di ba? And actually, when I look at this, it's kind of depressing. Yes, nakaka-depress siya. And yeah, let's get to know health system, because in the future, if you're going to be frontliners and health workers, this is the avenue where you will operate the health system. So when we say health system, so let's break it down first. When we say system, example, the most common system is the human body. It consists of different systems, right? To make systems in the body, so your cells, so your basic unit of the human body, so the group of cells will form tissues. And these tissues, the group of tissues will eventually form organs. And these organs will form organ system. So same thing with your health system class. It consists of different components, which are the different organizations, people, the resources class, physical, so it's both animate and inanimate objects, financing, and management, according to Romer. According to WHO, all activities. So from Romer, so it's telling the the composition of a health system. For WHO, its functions, all the activities whose primary purpose is to promote, restore, and maintain health. So guys, all these organizations, people, resources, financing, management, its main purpose is to promote, restore, and maintain health. Yan. So that is your health system, guys. So class, here are the different components of your health systems. So we have the communities because communities are the sites wherein health services are delivered. We have pharmaceutical companies, guys, who are now to racing to get the first vaccine for COVID. We have financing companies, we have private companies, we have public companies, we have healthcare providers, class, your medical laboratory scientists, we have barangay health workers, we have nurses, we have doctors, class, health services providers. So we have clinics, we have hospitals, this can be private and public. We have Bibron, dialysis center, and class, we have Department of Health. Yeah, and so class, we have, there's so much, and many more, guys. So class, what else? Non-profit organization has been key actors in the health system, like who else? Like big donors. Example, class, I heard a few days ago, New Zealand gave the Philippines 65 million pesos. Yan. As an aid response. So, saan kaya makapupunta, guys, yung 65 million? Anyway, so goals of a health system. So, what is the purpose of your health system? What are the missions of your health system, class? You know, the health system, its goals, class, are so ideal. Yan. Mga class, ang ganda-ganda pakinggan itong mga goals na to. Number 1, yan. It improves the health of population. It strives for equity in health. I mean. It strives for equity in health. Ma'am, what's the difference between equality and equity? Yan. Equality and equity. When we say equality, all people have the same opportunities. Yan. You give them the same opportunities. All people have equal opportunities when we say equality. When we say equity, class, we give the person what they need depending on their circumstance. We give the person what they need depending on their circumstance. So when we say strive for equity in health, class, we give everyone as much as possible healthcare, but we focus especially those who are most disadvantaged, those who most need healthcare. Yan. So that's what we say when we say equity. So example, we focus on the health of senior citizens because they are very frail. We focus on indigenous people. Yan. We focus on people who are socioeconomically disadvantaged. Something like that. So we improve health of the population. So no matter what your sex is, your sexual orientation, your ethnicity, class, your geographic location. So even though, class, your barangay is really far, your sitio, so you deserve that, you deserve healthcare. Yan. Number 2, class, improving the responsiveness of health system. And this is the goal of your health system, class, that the health service will be of quality, it will be accessible, it is timely, it is cost effective. So that's number 2. And number 3, class, providing fair health financing. Yan. Class, you know, many people experiences financial catastrophe. Many people resulted to poverty because of paying expensive medical bills, class. Example, if one family member is going through dialysis, class, a dialysis patient requires to go 3 times in a dialysis clinic, and per dialysis session, it will cost 2,250, something like that. So where will a family get 6,000 pesos a week, class? And so that's the cases that are happening. So many class are financially burdened because of healthcare. And the goal of health system is to make that burden lighter. That no one um, should be experiencing financial burden when they're sick. Yan. Because if that happens, it will result to financial catastrophe, then people will not access healthcare anymore. Di ba tama? So if you find that healthcare is expensive, then people won't go there. Yan. I think it's very common here in the Philippines that when they are feeling some symptoms, yan, they try uh, to shake it off or just forget it because they don't want to go to the doctor because they find it expensive. Yan. Or in their mind, it's expensive. But there are lots of opportunities for them. Yan. A lot of free medical services for them. So that's the goal of health system, diba? What an ideal thing to think about, that if these are true, then diba, everyone will be healthy. But apparently, that's not the case, you know. Find out later. So class, we mentioned the goals. Now we're on the function. Bilis, class. So what are the function? What are the intended activity? Yan. Intended purpose of our health system. So number one, health service provision. So it is the one who delivers or provides your healthcare program, your um, your healthcare services. So the healthcare services can expand from preventive health services, just like expanded immunization, EPI, expanded program on immunization, clinical, restorative, palliative care. So palliative care are the long-term care of people who have cancer, who have chronic pain, who have chronic diseases, services to improve health. Yan. So the health system is responsible to deliver all kinds of health programs, class. Health programs for pregnant women, health programs for mental health programs for reproductive health programs, guys, for nutrition. So, class, health system does a lot. Then, marami siyang functions. What else, class? Stewardship, class. So, overall system oversight or management. So, our Department of Health, our local government units, so they are responsible in managing our health. Yan. So class, even Mayor Magalong now, our mayor in Baguio City, has been part of the health system. Next, class, health service inputs or resource generation. So class, DOH health systems are responsible in procuring the different products that you need to deliver health services. So right now, class, the PPEs, they are responsible in accrediting health laboratories, testing laboratories, accrediting hospitals, class. They are the one, class, who generates resources. But class, health services inputs are the different resources. So we have medicine, but we also have vaccines and the like, and medical equipments, class, but also human resource. Yan. Human resource are health professionals, are health workers. Yan. They are the one who manages these people. Yan. And class, we have health financing. So our health system is responsible for pooling the resources. Example, pooling resources from government funds, pooling resources from the different departments in the Philippines, like PCSO. So the Philippine Charity and Sweepstakes Organization. So some of the revenue there goes to health. What else? Sin taxes. The taxes for alcohol, for cigarette, it goes to healthcare. Yan. So they are the one, health financing, so they are responsible for raising and pooling resources. Example, PhilHealth. So it's a government agency which pools resources from contributors. So those are the four functions, and four major functions. So class, I want to elaborate more about health financing. Let's talk about health financing. So in our notes class, we will find two major classifications of health financing. So how do we finance or pay for health? So first, we have revenue collection, and second, we have risk pooling. For revenue collection, so they are collected from the payments of health services. So how do we pay for health services? Either from taxation, so that's what I say, from sin taxes or from the government budget allocation. Number two, out-of-pocket payment. So when we say out-of-pocket payment, meaning the patient directly pays for their healthcare, or the patient directly pays out of pocket mismo. They directly pay for the cost, or they directly burden the cost of the health services that they get, and payroll contribution. So just like, so those who are working, because I'm asking my students how are working. When you are working, guys, and you have an employer, so this employer will apply you to PhilHealth, or you can, sometimes you can voluntary contribute to PhilHealth. So back then, it's 200 pesos per month. But now, it's due to universal healthcare law, now it's 300 pesos per month. Yan. So, since my employer is University of Baguio, so University of Baguio pays 300 pesos per month to PhilHealth. Yan. And so that's my contribution. So that's a payroll contribution. Something like that. Next class, risk pooling. So risk pooling, we have two models. We have Bismarck model and beverage pooling. When we say Bismarck model class, so sickness fund is paid by employees and employers. So Bismarck model class is like PhilHealth, wherein those who have employers, and but not all, so this is a way of payment for PhilHealth, that your employers and employees class will pool. They will pool class the monies all. They will gather all the money from the different employees all over the Philippines, and they will pool the money. Yan. And those employees who needs the money during that time, they are the one who will get the sickness fund. So they will get, so we will have a pot of money. Yan. So a big pot of money. And eventually, if one employee will get sick, so they will get that pot of money. And sometimes, so the healthy employees can keep on paying, and some of the sick employee will get the sickness fund. Yan. So class, imagine I only pay 300 pesos. But class, when I had thyroid surgery, so my thyroid was removed, class, PhilHealth paid about 30,000 pesos of my bill, class. I think 30,000. He paid 30,000. Ayan. So 30,000 was subtracted from my bill, class. So it was a big help, because during that time I was the sick employee, and I need to get from the fund of PhilHealth. So class, PhilHealth is a good scheme, but I know we're hearing so much bad news about it, and it's reducing the trust of people. It's reducing, or it's marring the reputation of PhilHealth. But so far, how PhilHealth does it is actually good. How they pay for healthcare, actually, it was twice already that I used my PhilHealth, because back then I had community acquired pneumonia. So PhilHealth paid 6,000 pesos of my bill. Yan. So I don't have to pay anything. So, class. So good naman yan. So that's Bismarck model, when employers and employees, yan, are the one who makes a sick fund. And we have beverage pooling. Example, in the UK class, in Canada, health service is paid by the government through tax payments. Yan. So class, actually this is good, right? So the government are the one who directly pay health services, meaning class, almost all hospitals in UK are public hospitals, yeah? And the government are the one who pays. And the good news about that is health services are free, but class, they have to pay high tax payments. But you know, it's good, guys. At least they know where their tax are going, diba? You know, class, unfortunately, we still have about 50% out of pocket payment here in the Philippines. Yeah. So half of the patients here in the Philippines burden the cost of their health expenditure. So that's so sad. So class, we have this W Health Systems Framework. WHO Health Systems Framework. So class, your health system is so broad, and it's so broad. So what WHO did is it divided it into 6. Yeah, it divided it into 6 so it be easier. It divided it into building blocks, into unit, so that it's easier to understand. Yan, para madaling digest. So guys, so first one is we have our service delivery. So I told you, so service delivery is the delivery of the different health programs and the health services, that it should be of quality, it should be accessible, it should be safe. Health workforce, so under the resource management or health input, so the workforce, so in the health system, so you manage the people who are working under the health system. So your doctors, your pharmacists. Next class, your health information system. So this will be the focus of our discussions and for the coming modules. So health information system is a vital part of your health system. So it is the one who produce information, it analyzes information, it disseminates information, and it is the one who provides timely and reliable information. I told you information is so valuable for policy making, for decision making, for service delivery. Yeah. So example, so if they gathered information that apparently in this region or in this province, there is increased cases of measles. So that place is where we will deliver or disseminate measles vaccines. And something like that. Next class, medical products. So medical products, so we have your vaccines, your drugs, your antibiotics. So we make sure that there is equitable access, especially now, class, there is increased demand on hypertensive maintenance drugs, on insulin, class. So we make sure it's cost effective. Next class, financing. So your type of financing in health system must be such a way that it will protect people from financial risks and to promote the accessibility of services so that people will access health services. Yeah. And class, leadership and governance. So they should ensure strategic policies are being given. So example, our universal healthcare law, proper management or oversight, there should be accountability, there should be building partnerships with other countries or private sectors. Yan, to intensify or strengthen our health system. Yan. So class, these are the 6 building blocks of our health systems. Yan. So class, so there's a need that to strengthen this building blocks. Yeah. So these building blocks will ensure the access coverage, will ensure that the services are of quality and they are safe. And class, what will be the outcomes, the goals of your health system? To improve health, improve the responsiveness of health, that it will be based on the needs of the people, protect the people from financial catastrophe, from social risk, yan, discrimination and such. And class, improve efficiency. Yan, class, you know, health system is supposed to be good. Class, there is good in our health system. Yan. I just focus on the bad news. But, you know, there's still hope with our health system. Diba? So now, class, we will focus on your Philippine health system. This is going to be short, don't worry. So class, here are the good news of your health system. So class, so far since 2000 to 2020 class, so our life expectancy according to DOH 2018, so this is from Philippine Statistics Office 2016. So class, tumaas daw. So ang life expectancy ng mga Filipinos life expectancy increase up to 72, age of 72. What else, class? So maternal mortality ratio so far. So the ratio of maternal related deaths, so deaths that are caused by pregnancy, so it has decreased. So 114 per birth na lang ata, parang gano'n, 114. Next, class. We have slow decline in maternal mortality ratio per 100,000 live births. So in every 100,000 births that's happening, only 114 die, but actually that's still a high number. What else? Infant mortality rate. So for every 1,000 live births, so 1,000 babies who are birth, class, only 23 dies. And under 5 mortality. So kids which are ages 1 to 5 years old. So in 2013, only 31 dies. Okay. Next, class. Sorry, natawa ko. And class, high prevalence of stunting over the years among children under 5 years old. Class, in the Philippines, due to malnutrition, some children had difficulty growing. So we call it a stunting due to malnutrition or undernutrition. Now, so the prevalence, so there are now only 33.4% stunted children. But marami pa rin yun, guys. Okay, DOH. Yeah. So class, so let's explore the Philippine health system through number 1, leadership and governance. And so let's explore how is the health system of the Philippines governed. So we have the local government code in 1991. It led to dual governance in health. So it decentralized health. So now, it's not only DOH that governs health at the national level, but we also have the local government units. So class, not only DOH decides for health. Class, it is actually fragmented. Naghiwalay-hiwalay. It is already decentralized. Yan. The power has been distributed. So not only the DOH governs health, but also the local government unit. Class, actually, it's both a good news and bad news. So let's see, class. So before the local code of 1991, so the Department of Health, so the Department of Health has different regional office, and the regional office are the one who decides for the rural health unit, district hospital. So, yan, class. The DOH is responsible for the management of district hospitals, of rural health units. So when it is a harsh line, a solid line, so means they have direct management over it. Yan. So the DOH provincial offices and the DOH regional offices directly manages your rural health units. When we say rural health units, the health facilities in the barangays, in the towns, yon, in the health centers, they are the one who manage it. But now, class, so look at this image. So at present, class, so the Department of Health now manage PhilHealth. Class, ito naman tayo, Phil. You know, sometimes when I mention PhilHealth, I don't know, my soul cringe. Sorry, guys. So your DOH directly manage your DOH regional offices. So they are the one who manages because it's a solid line. But now Now, your DOH regional offices do not directly manage your district hospitals, your rural health units. Now, the rural health units are managed by your municipal governments, your city hospitals here in Baguio. Our health centers are managed by the city government. So, the provincial governments, class in Ilagan, in Santiago, so yung mga na-interview class in Ilocos, class. So, the district hospitals are governed by the provincial government. Class, I told you, there's good things in here and bad things in here. Yan. So imagine, class, in your municipal governments, in city governments, that our mayors actually decide for our health, since they are the one who governs your rural health units. So they are part of decision making, though they are not health professional. Class, your governor, again. So whether he is versed in healthcare or not, he will decide for the district hospital of your province. Yan. So it's a good thing or bad thing. Yan. So class, let's just differentiate their functions. So your DOH function, so they develop the policies, the plans, the guidelines for health. Class DOH is part of IATF, the Interagency Task Force of COVID-19. Class they license hospitals, laboratories, and health facilities through HFSRB. Yan. Class, please search what does HFSRB mean. So they are the one who license. So there were news that DOH has been so slow in licensing these laboratories during COVID-19. And class, the health products or testing kits are approved by your FDA. Yeah. So class, your DOH partners with the different government offices, your private sectors, your non-profit organization, the other countries who are willing to be donors to leverage funds for improved health performance. Yeah. Class, next we have local government units. So class, local government units, they deliver and manage the health services. So class, next is health service delivery. So I love this image. It made my job easier. For the health service delivery class, so when health services are delivered to the Filipinos, it's a mix of public and private partnership. So some health services are from the government, some health services are from profit and non-profit or private organizations. So your national, your DOH class, so they organize, they fund the health services in your regional hospitals, in your specialized hospitals, in medical centers. Okay. Next class, your local government units, they are the one who delivers health services in your provincial hospitals, district hospitals, rural health units. Next class, we have the private organizations. So we have for-profit practitioners, private clinics, private laboratories, and we have for non-profit, social civic groups, religious organizations. So class, example, University of Baguio, we have outreaches. So before COVID, we have yearly outreaches to different barangays. So that's free. Yeah, and so that's part of a health service delivery. Yeah, something like that. So class, health financing. So let's just have an overview of how is health finance here in the Philippines. So class, we have PhilHealth, social insurance. So PhilHealth is our national social health insurance agency since 1995. Class, only 16.7% utilizes PhilHealth. Yan. So according to studies, 18.9% are from government taxes, government allocation, from sin taxes, from government subsidies. Class, who else finances health? Private insurance companies. And class, who else? 52.2% are still out-of-pocket payment, because this is a red flag. So meaning 50% of the Filipinos burden the cost of healthcare. Diba? And it can turn into a financial catastrophe. Plus, if you will watch K-drama, teleserye, if the family is poor, if the family is poor, most probably there is someone who is sick. Yan. So so sickness class puts them in a cycle of poverty. Yan. They cannot get out of poverty because of paying expensive health bills, something like that. So that's here in the Philippines. So 52.2% are still out of pocket payment. So many have private insurances. We have government taxes, which is 18.9%. That's so low. And we have PhilHealth, 16.7%. That's still low. Yeah. Class, ayan, I need you guys. Yan, I'm teaching you this so that, you know, at some point you're going to be health professionals. At some point you will work in our rural, I hope you'll work in our rural health unit as a medtech or as a doctor. I hope that you will work in our provincial districts. I hope that you will work in DOH, because we need more people who are very versed in the health system and would want to improve the health outcomes of Filipinos. Class, we need more good health professionals, competent health professionals, class, competent administrators. I hope, class, that you will become mayor or governor or replace Francisco Duque III. Sorry na. Sorry, guys. Okay. So finally, class, we have our Universal Healthcare Law. Yan. So Universal Healthcare Law is now a law. It's Republic Act 11223. Kalusugang Pangkalahatan. Wow, ganda, class. Which aims to achieve universal healthcare and ensure equitable access to quality healthcare by all Filipinos. Yan. So, class, I'm reading the news and I'm waiting for universal healthcare to be fully implemented. Still, right now there's still amending some portion of universal healthcare because they're trying to remove the obliging of OFWs to pay in PhilHealth. Yeah, because they're obliging OFW. The OFW have better healthcare where they are working. Yeah. And class, what are the 3 strategies of universal healthcare? So, all will have coverage in PhilHealth. Lahat ng Pilipino sagot ng PhilHealth. Accessibility of health services and increased number of health professionals. Class, universal healthcare is very ideal. Yan. But yun, one of the main agencies that they were trying to fund heavily, class, is PhilHealth, and now it's under fire. And there's a need to change the system on the systems in PhilHealth so that universal healthcare will be implemented properly. So class, so let's end this discussion on a lighter note. So thank you guys for listening, and I hope you've learned something about health system. Guys, I want you to be competent health professionals, health administrators in the future, and so that we can improve the health systems of the Philippines. Yan. So I'll see you in our next lecture. Thank you for listening, guys. Maraming salamat. I'll see you